One baby cries. Another barely moves. Yet another struggles to breathe. One mother screams in pain. Another sobs in despair.
I'm afraid that something terrible's going to happen.
Hi, sweetheart.
The high-risk unit
Thank you, God.
takes an emotional toll. When it comes to special deliveries and those remarkable first signs of life. Sitting in the shadow of the majestic Rocky Mountains, Denver's Presbyterian St. Luke's Medical Center is the final stop for high-risk mothers-to-be who come from as far as the Canadian border to ensure that their babies make it into this world as safely as possible. Today, an AirLife chopper is delivering some very precious cargo. Megan Dangler and her unborn twins. Pregnant almost 35 weeks, Megan was hoping to deliver at her local hospital in Aspen.
Can I be with him?
No. Okay. And we'll come and get you. It'll be 2 seconds.
But her babies had a different plan, and they chose a memorable moment to announce it.
It's a little cool on your back.
My water broke as the last kick was made at the Super Bowl. Then we went on the adventure from Aspen, Colorado to Denver, and we did planes and helicopters and ambulances. And we're about to do a C-section.
I don't like her in there. You have no control on what's going on right now. But lots of people are praying, so it'll be perfect.
It's right back in my hands. I've got you.
Giving birth in Aspen would have put these babies at greater risk.
Because of the altitude, they won't deliver there unless the babies are 36 weeks, and we're at 34 in 4 days.
At 8,300 feet, Aspen's elevation takes its toll on anyone who isn't used to the thinner air. And premature babies with underdeveloped lungs would have to fight for survival.
All right. She's comfortable. Come on in. Stay on
Here in Denver, 3,000 feet lower, their chances are slightly better. But doctors right now are more concerned about something else. Not only are the babies premature, one of them is in the wrong position.
I'll go wash my hands. You ready?
Yes.
So what time do you think she's going to come out?
I'm predicting 12-17.
I'm saying around 2.
Christine Holmwood is 40 weeks, term, and already at 8 centimeters. She's about to deliver.
Come on, baby, we want you to come out. Don't you hear everyone talking about you?
But she's terrified.
Just full of a million emotions. Definitely nervous, scared, and just ready, I think.
And for good reason.
It's just been a really tough road for us to have a baby.
We've been trying for, what, two and a half years, 3 years?
We lost twins at 18 weeks about a year ago, and so we've had 2 miscarriages. Now to be able to be full term, it's just overwhelming. It's just really scary because I'm not going to believe it till I have her in my arms.
Christine was only 18 weeks pregnant with those twins when baby A's water broke, and she was rushed to the hospital.
We were going to do an amniocentesis, see if there was enough fluid there for the baby to be okay, and found that there was no heartbeat for our baby boy. It was heartbreaking, but you know, we still had another baby.
Christine had to endure an unbearable task. She had to deliver her stillborn baby to save the life of her other twin.
We delivered our son, and we were able to hold him and see him. It was like nothing that I could ever imagine. You know, the baby weighed about 8 ounces. It was shocking and devastating. His name was Ryan Michael. We had him baptized in the hospital here.
3 days later, tragedy struck again. Baby B's water broke.
You know, we knew at that point that it was over and that we were going to give birth to Nicole within 24 hours and that she probably would be born lifeless without breath or anything. And that's exactly what happened. What they think happened is that my cervix had started opening and that some bacteria must have traveled up through the vagina and got into that sac and caused an infection.
To keep that from happening this time, during labor, Christine will be given antibiotics every 6 hours until she delivers. Since medication is not being given over a lengthy period, the baby won't have time to develop a resistance to the drugs.
Without the antibiotics, the baby has a potential of getting very, very ill with the respiratory infections, and there is the possibility of death. So we will not tell Christine that.
But there's another setback. Her baby has had a bowel movement in utero. It's called meconium, and it can be deadly.
They can get very, very sick from inhaling that because it goes directly into their lungs first breath they take. And so basically you want to get all that out before they take their first deep breath.
I'm afraid that something terrible's going to happen, and I'm just worried. It just makes me nervous, you know, like everything's going on. It's
been hard, but it's just starting to hit me right now.
I'm just getting scared. I just want the baby to come out and make sure she's okay.
"29-year-old Ann Mercer has spent a lot of time in this hospital room trying to put off the birth of her second child.
I've been here 3 weeks, and I'm here because my baby's not growing.
Ann's baby is 3 weeks behind in growth. In other words, at 34 weeks, she's the size of a 31-week fetus.
They thought maybe there was some kind of genetic problem, so they wanted to do more tests, and I've had 2 amnios. One to test the chromosomes, and those all came back normal, and she's definitely a girl. And then the other one was to test the lung development, and that came back immature, so we're not delivering yet.
Ann, who works as an on-call nurse at area hospitals, is keeping optimistic.
All the tests look normal, her anatomy is good, and so she's just small. And me and my boyfriend are both small people, so they're thinking that it could just be that. You know, she's coming from small parents.
But a small baby and a high-risk mom come with a whole set of problems.
I'm high risk because the baby looks like she's gonna come too early, and she's very small for her gestational age. And so those contribute to each other, and we could have, you know, vision problems and mental retardation, cerebral palsy. Initially, she can end up in the NICU for a long time with needing help with her breathing and being on a ventilator, and brain bleeds. Lots of stuff can happen.
For now, the tests look promising, but some problems can't be predicted by amniocentesis or ultrasound, as Ann will soon learn. Dorinda Gallegos is 39 weeks pregnant. She's in the middle of her labor walk, a walk she's taken many times in her life. This is Dorinda's 8th baby.
So how you feeling?
I don't know. This is
What's
really
going
weird.
on?
I have like a lot of pressure.
But number 8 is special.
This one's so different. I just feel so paranoid.
It's Dorinda's first boy, and he's taking his sweet time, something this mother is used to.
Everything just seems real different. Just real concerned about having a baby too quick and not being at the hospital to have it done.
Just relax.
Despite a solid track record with her previous pregnancies, nurses are concerned.
Dorinda is a grand mal tip, which means that she's had multiple pregnancies.
Her uterus has just been stretched and worked and gone back down, been stretched and worked so many times that sometimes after delivery it tends to not want to clamp down quite as well.
My biggest concern with the delivery is that it is number 8. And that I do have an oversized placenta, that I had problems with my uterus contracting and had hemorrhaging with my last daughter. And I'm just afraid that it could go that same route, being the number of baby that it is.
I haven't really seen her have any contractions since she's been here. Now, if she's unchanged in 2 hours, do you want me to go ahead and send her home, or do you want me to call you back?
Dorinda's body won't go into labor. False alarm. It's still too early. It's a tough call,
I talked to Jeannie Bear, and
but her nurse practitioner decides to send her home. She'll be more comfortable there, but not for long.
What's going on with her?
5 hours later,
Contracting, pressure. Okay, what's the estimated time of arrival?
Megan Dangler's day began with an emergency airlift from Aspen to Denver, ending here in the OR, ready to deliver her twins. A C-section is the only way to deliver these babies, because one of the babies is in a breech or feet-first position.
But whenever babies are breech position, it can be difficult to get them turned around. And given that this baby was the smaller and more fragile of the two babies, the decision was made to deliver them by C-section.
You probably weren't planning to deliver these twins today, I'll bet, huh?
No, we're right down to the uterus. Maybe they'll be coming in a moment.
Baby A, Katie, comes out feet first.
Come on out of there, you. You with the ruptured membranes. He's coming. Hi there, sweetheart.
She's opening her eyes.
Katie, Katie, Katie.
Thank you.
She was laying
Comes the second baby.
Her sister Ellie follows, head first.
It's a little girl. All slimy.
I know she's been kicking the junk out of me. I did her.
The delivery went smoothly. Now comes the hard part, making sure these premature babies survive the critical first 72 hours of life.
Congratulations.
5 hours after being sent home, Dorinda Gallego is back, and this time it's no false alarm.
They sent her home, and she obviously remained uncomfortable enough that she returned, I believe, about 3 o'clock this morning.
Roll towards me.
Based on the fact that she had already been in once, was obviously uncomfortable with her contractions, they just decided to go ahead and let her stay and just help the labor along.
So I want to check and see what's going on.
And since this is her 8th baby, the length of labor is unpredictable.
Okay, your cervix is thinned out a little bit more. The top of the cervix is now 5 centimeters, and that was 4 a little bit earlier. I may call Dr. Williams and talk to her about starting some Pitocin.
Dorinda's cervix was telling us that she was ready to labor, but her uterus was not working as efficiently as possible.
Hello.
But Dorinda's weakened uterus is slowing down her labor, which can put her baby in considerable danger.
Dorinda's working very hard with her contractions, with her breathing and relaxation techniques, and eventually she will face exhaustion. The baby, who is being kind of squeezed in the uterus every 2 or 3, 4 minutes, is eventually going to feel the effects of that and begin to feel a little bit stressed, which means that the baby's just not getting as much oxygen as perhaps it needs. At that point in time, if there were no intervention, if we didn't do something, or if this were happening at home for Dorinda, that baby would eventually die.
Push this part of your back out towards me. Perfect.
Her 8th baby, her first son, her worn-out uterus. There's a lot at stake in the next few hours.
You know, I just hope everything goes well for me and for the baby. It's real hard. It's pretty scary stuff. Just because, you know, I'm 28, so it's quite a bit behind me for 28. And I'd be afraid to leave the kids that I do have now. So it's real scary for me.
Say that again. You be good for grandma?
21-year-old Marissa Padilla kisses her 2 boys goodbye and settles in for a long and probably painful labor.
Bye, be good boy. Love yous. Contractions are
coming pretty strong. I'm trying to keep the medicine away though, as long as I could tolerate it.
Marissa wants to deliver her first baby girl without the benefit of an epidural.
It hurts a lot, but the more natural I can keep it, the better.
We talked to Dr. Williams, and she's basically on standby. I'm gonna call her when you're about 8 to 9 centimeters so she can make sure she gets here on time.
At 4 centimeters, Marissa barely registers mild discomfort.
If you wanna do a jacuzzi bath, you can do that. No?
There's an idea.
Sometimes that helps to kind of relax you, and just, it doesn't take the pain away, obviously, but sometimes it just kind of helps you to relax a little bit and let those contractions really kind of open up that cervix. If that sounds good, let's maybe do that. And then,
Marissa is prepared to deal with the pain of labor and delivery.
Really painful experience, but I think it's just more in your head than anywhere else. I think if you let the pain get to you, it's gonna bother you, but for me it was, I'm more mellow. I could tolerate it really good.
But not all natural births are the same. Some come out nice and easy. Others take their sweet time. Marissa says she can handle any kind of pain. Today, she'll find out.
I just want you to think some positive thoughts now for a while, okay? If it bothers you, don't look at the monitor. Look this way and just think about, just I've got some pushing to do. You need to save your energy and use it in a positive way, okay?
Christine hasn't progressed much in the past 3 hours, and it's taking its toll on the anxious mother-to-be.
Yeah, it's not changed at all. She's been at -1 for forever.
Okay, not to worry. You can move the pit up a little bit. Okay. You're not going anywhere.
Her baby is still high, and the Pitocin's not helping. Adding to the situation, the baby is floating in meconium, having had a bowel movement in her mother's womb. And now, the baby's oxygen levels are getting lower.
It's like being at 20, is that dangerous right now, or is that just...
no, it's just telling us that this might be time to
Okay.
get this baby out.
Looks like it's struggling to get up there.
Finally, Christine's doctor makes his decision.
So we're going to stop your labor and deliver abdominally. We'll see what happens here.
Christine's doctor was there when her last pregnancy ended with the devastating loss of her twins. He understands her distress.
I'm ready.
Given that she needs a lot of labor to bring that head down, it looks like the writing's on the wall. And given, her past obstetrical history, which you probably heard about with those babies, and I think as you heard her say, I want this baby out, I'm not going to argue with her.
Okay, here's your consent.
Christine is relieved.
I'm not disappointed. I'm actually more excited because now I know, now we're in a half an hour, I'm going to have my baby, so I'm a little scared about the surgery, but I'm excited. I'm relieved. No. Aren't you?
I just want to get this baby out, so enough stress on Christine.
I don't know why I'm crying.
You're having a baby.
The day Christine and Bob Homewood have been hoping and praying for has finally arrived.
Time to get the baby.
Yeah. This must be somebody who knows her.
Oh, hi, Spunkin.
Megan Dangler's family has just been given the good news.
Is that not the best? She's okay, Danny. Were you okay?
But the twins need to be assessed before they get a clean bill of health.
Any bets on the way?
Baby A, Katie, is the smaller of the two.
3 pounds. On the button. When we exhale.
Baby B, Ellie, is over a pound bigger, but she's having trouble breathing.
Just put a breathing tube in for her, and we'll. She needed a little help.
We always wonder about a baby who is having increased difficulty breathing, about the possibility of an infection. So she most likely will be started on antibiotics after some appropriate cultures are taken to make sure she does not have pneumonia.
Sister, you gotta take deep breaths.
Right now, Ellie is the one requiring the most medical assistance.
Gotta get those lungs to work.
You want me to say Peggy Martin and then spell both names? Okay.
Good idea, huh?
Peggy Martin.
38 and a half.
But the Dangler twins are about to take a turn, for better and worse.
I feel a lot better now. We know it's going to happen.
Trying to stay calm.
After 3 unsuccessful pregnancies and the tragic loss of her twins, Christine Holmwood is about to finally have a special delivery.
A very big incision, Ann. Give me another hemostat, please.
Ooh.
What's her name?
Lindsay.
Lindsay. Come on out of there, Lindsay, damn it.
Is she big?
Oh, I don't know, I made it too small an incision. Trying to think cosmetically for you, Chris, you know?
Oh, it's coming.
Hi, sweetheart. Get that anterior shoulder. Hi, sweetheart. She's coming.
Thank you, God.
Oh, cough, cough, cough.
Baby Lindsay is trying to cry, but her lungs are filled with meconium. She needs to have it suctioned immediately.
Okay, girl. Good girl, cough it up.
I don't believe it.
That's okay, we're good.
We got a chubby baby like we wanted.
It's amazing. I can't even explain it right now.
Finally, the long, hard struggle is over. Lindsay Nicole Holmwood is big, 8 pounds, 7 ounces.
Look how happy she is in your arms.
But her lungs are struggling with the excess sticky, tar-like meconium.
You can hear in between when she's breathing, she does this kind of like, she's trying to open up all those alveoli. Would you get me a delete?
An oxygen hood is placed over her head.
So we'll put her in 100% oxygen, which decreases the swelling, and also with lots of humidity, so we can thin that stuff out and she can cough it. Because she's a big girl, she should be able to clear it up.
Oh. Lindsay. Oh. Lindsay.
Lindsay's family is just happy that she's made it this far.
Grandma.
Oh,
How you
Lindsay,
doing, Grandma?
Finally here. Oh, God, she's a big little girl.
She is.
Welcome. Oh, she is beautiful.
After being on bed rest for over a month, Ann Mercer has hit the crucial 36-week mark.
I'm going over to the ultrasound room to do a growth study to check and see how big she is.
The news is not good.
The babe's growth, which was already quite small, fell off another bit. The baby was 4 weeks behind last time, and today it's 5 weeks behind, so if you will, it lost another week's worth of growth over the 2-week interval.
Her baby could be suffering from 1 or 2 rare genetic conditions.
Cornelia de Lange would be one, Russell Silver is another one. Delivered here.
Russell Silver syndrome babies have a number of disabilities, including body asymmetry, webbing of the toes, and abnormally prominent facial features.
Russell Silver is more of a problem, and they tend to have more intellectual deficits. Cornelia de Lange, as an example, those babies, how they do intellectually and otherwise is extremely variable. Some do very, very well intellectually and have normal development, but are small.
Still, Ann's doctor is hopeful.
My best guess is that this is a normal, small baby.
One thing's for certain. If this baby refuses to grow in utero, she'll do much better on the outside. At 36 weeks, the maturity of the baby's lungs is no longer an issue. The decision is made to schedule a C-section.
Friday the 13th.
Okay.
Well, we're all anxious to see how it turns out here.
On that day, Ann will find out if her baby is severely disabled or simply small.
Oh my God, oh my God.
Dorinda Gallegos is about to deliver her 8th baby.
It's okay. Don't panic. This is why you're here.
And because it's her 8th baby, her midwife has taken extra precautions.
We're always prepared with somebody with 6 or more babies about extra bleeding, and so we have an IV and we will have medication to control the bleeding if that happens.
It hurts so bad.
Dorinda's uterus is overworked, and there's a good chance it won't be able to clamp down on its blood vessels after delivery.
If the uterus doesn't contract and constrict those blood vessels, mothers can lose a huge amount of blood in a very short amount of time. Many of the maternal deaths in the past were caused by just losing all your blood.
Push. Come on, push.
Good, good, good.
Excellent.
Wonderful, excellent. One more time. And push. Come on.
Awesome. Good job.
And right again. And right again. Push. Another push.
Oh, God, it hurts so bad. Oh,
Okay.
God.
Hang with it.
Look at the baby. Look at your baby.
It is a blanket.
You need to breathe, baby.
That's right.
After 7 daughters, Dorinda Gallegos gives birth to her first son, Rudy. He is 8 pounds, 4 ounces, and flawless, except for 2 perfectly symmetrical marks on his arms. Nurses think they are sucking blisters.
Not real common, but you see it occasionally, where a baby's just been sucking so hard on something, and it's usually up near here that they actually have blisters like that. I've never seen one on both sides.
Despite being overworked, Dorinda's uterus didn't suffer any unusual postpartum bleeding. After delivery, it continued to contract and prevented any possibility of a hemorrhage.
Oh my gosh, it's a huge relief. I was so worried, so scared. The whole thing had me really freaked out, so I'm glad it's over. I love him. I've just been waiting for him.
We are headed to the nursery to see Katie. I keep doing that, Katie and Ellie.
Katie and Ellie Dangler may be twins, but when it comes to their preemie status, they couldn't be more different.
She's still got her little sunglasses on.
Katie, the smaller of the two, is jaundiced. 80% of preemies are born with more red blood cells than they need. The excess cells are called bilirubin, and since her immature liver can't dispose of the bilirubin fast enough, it causes a yellow tint to her skin.
I'm my little sunbather.
She needs photolight therapy to dissolve the extra yellow pigment in the skin, allowing it to be excreted through the urine. Also, being the smaller of the two, Katie may have been deprived of some blood flow and oxygen to her organs, so she's being fed intravenously.
If we were to try feedings on her, chances are she would not tolerate them, she might throw them up, she might develop an intestinal infection, because we're waiting for a period of time for her intestines to establish good oxygen delivery, good blood flow, and to resume their normal function and ability to digest the feedings.
She's not gaining weight quite as fast as Ellie is, so her food hasn't gone up at all, but she's still taking it in each day.
At first, younger sister Ellie suffered breathing problems, but doctors took her off her ventilator within 24 hours. Soon after, she had her first feeding.
This is Elizabeth Love Dangler, and we're calling her Ellie, and this is the first time I've fed her. And this is about a teaspoon. Not very much. There's your full meal. Time to grow now.
3 minutes apart.
A couple of hours ago, Marissa Padilla scoffed at the notion of an epidural. But several severe contractions later, and the idea is suddenly becoming appealing.
These contractions are just hitting me in one little spot is right here, and it's just not moving. I can't get it comfortable.
trying to find a position to relax myself while they're coming, and it's just not working. It could take 4 hours, and I am not gonna sit through all that pain for 4 hours.
After the epidural is administered,
Not too bad? Good.
Marissa goes from 6 centimeters to complete in a matter of minutes. Her baby's on its way, but her doctor is still en route.
We're complete, and we're calling the doctor, and we're gonna have a baby.
I've been waiting for you. This baby's coming, and I'm waiting.
Okay, well, let's get going.
Oh my goodness.
I almost ran a red light, and I didn't because there was a cop right behind me.
Here.
Yeah, get over here. So are you cutting the cord?
Yes.
Okay. Go for it.
Oh.
You're contracting now because this head's coming.
Keep going.
I can see hair. More. There you go. Keep on pushing. Harder.
Oh God. It looks like Marty, babe. It's like Marty.
She's gorgeous.
At 2:35 a.m., Brianna Padilla is born.
She's very vigorous. She's fine.
Cute. Marty, babe. Yeah, she's a cutie patootie.
5 pounds, 15 ounces, and already the apple of her father's eye.
Fine.
Yeah, contractions are getting worse. But it's okay. I can take it.
Today, 27-year-old Kotomi Yoshida and her husband Jake should be caring for a 1-week-old baby. Instead, Kotomi is 1 week overdue, 41 weeks pregnant.
It is moving. I know it's getting closer and closer. It's exciting but a little scary.
An overdue baby can be in as great a danger as a preemie.
In years past, we often let women go 2 weeks beyond their due date, but we found that there was many more instances of stillborn babies, or in some cases, even conditions such as cerebral palsy.
You want that epidural?
Sure. Why not?
By 41 weeks, the uterus is losing its effectiveness. The baby's blood supply and nutrients become severely depleted.
Oh, I think it's coming.
Yeah.
To make matters worse, yesterday Kotomi started bleeding. Then, the ultimate scare.
I woke up at 8 and contraction was gone. I didn't feel anything anymore, and I didn't really feel the baby moving.
An ultrasound determined that because of her aging placenta, the fluids around the baby were low.
Lack of movement can indicate that the baby is becoming compromised. This is usually because the placenta is becoming too old, and there's inadequate nutrition, or in some cases even inadequate oxygen crossing over to the baby.
The nurse put the monitor on me, and immediately the baby started moving. So she said, everything is okay, don't worry about anything. But they just wanted to make sure, so I just lied down for a couple of hours, and they told me they can just induce the labor today.
But because it's her first baby, it's slow going. 5 hours later, she's barely dilating.
She's about 70%, 3 to 4.
Okay.
-1. All right.
Thank you.
I'll be in to see you a little later, okay?
Okay.
All right.
It's going to be a long night for this first-time mom. It's Friday the 13th. But it looks like a lucky day for Ann Mercer and her boyfriend, Ryan.
We are going to be doing Ann's cesarean delivery after she's been here for 6 weeks, so finally we'll get to see her little daughter.
They made the incision yet?
Yeah, we're well underway, guys.
However, there's a cloud hanging over this birth, the possibility that Ann's baby might have a rare birth defect. If so, it will be noticeable immediately by the baby's physical abnormality.
I just hope the baby's okay.
We already know that the lungs are probably not going to be mature, so we know that the neonatologists are going to be there to do what they need to do for her daughter.
Within minutes of making the first incision, Anne's doctor reaches in and pulls out the tiny baby.
Tiny, tiny. There she is.
Good job, sweetie. Let's look at her back real quick, make sure we're morphologically normal. Looks good. Hi, happy birthday. And she's actually pretty regular. So that's acceptable. Tone, good tone. This is good tone for a preemie.
Berlin Mercer appears to be a perfectly formed, normal baby.
Got your baby girl here. I'm gonna say really, I know here, I'll put her next to your hand here. I know. Say hi, Mom.
Oh, look how little she is.
Take this off for a second if you want and reach up.
She's gonna go to the NICU. I know, that's your mama.
She's beautiful.
But she's small. Her growth has been inhibited. Right now, she needs to catch up to her 36 weeks.
All right, Kim. Got a little admission here.
Oh. Right now, really all Berlin is having done is stabilizing her, making sure that her airway's clear, suctioning out any extra mucus that she may have, taking her blood pressure, her respirations, her heart rate, putting her on a pulse oximetry that actually tells us how she's oxygenating and whether or not we need to give her oxygen. But she's so vigorous that that's actually the sneak preview that she's probably doing fine.
Berlin weighs 3 pounds, 10 ounces.
Who is this little humanoid? Just checking out her plumbing. I think she looks real good. She's certainly active, isn't she?
Her mom will have her hands full.
Berlin's doctor can also start to make some other determinations about this baby's long-term prognosis.
She looks like a normal 36-week female infant who does not look like she has any syndromic features. It's just a little small for her gestational age.
But even for her small size, her outlook is getting better and better.
There's always little setbacks here and there, and she'll let us know if she's ready to conquer all of them when she is.
Today, Brianna Padilla is going home.
Now I got 2 beautiful girls.
And she already rules the roost.
I tell my husband, I'm like, wow, this is our daughter. This, you know, this is something new. And, you know, I have 2 kids already, but I didn't know what to expect with a little girl. I look in her eyes and I said, well, you know, she's my little sweetheart.
Despite doctors' initial fears that Marissa could go into a postpartum hemorrhage, her delivery yielded no setbacks and one perfect special delivery.
Okay, you got everything else?
We were told that we might lose her. But she's strong. She's strong. She went through a lot. She's amazing. It would have been hard if we did lose her.
There we go. All better. Yeah, I feel very blessed that everything turned out the way it did. Knowing that there could have been a turn for the worse, I'm glad we're out of that.
Daddy's here.
Today, Rudy Gallegos meets his son, Rudy.
I finally got my boy, and I'm happy. This was going to be our last kid, and we lucked out and I got my wish. So now I got my little junior, little baby Rudy. It's okay, baby.
Rudy had 7 good excuses for not being at his son's birth.
Well, I wasn't here for the birth because I was actually at the house taking care of the kids, and you know, it was a hard deal to try to be able to get somebody to watch them.
But he's here now for baby's first bath. Today, the Gallegos family is complete. 2 parents, 7 sisters, and 1 special delivery.
Yesterday after I had the baby and everything kind of calmed down, I got my tubes tied. And it's kind of a good thing. Good way to end it all with 8 kids, finally a little boy. So good way to close that chapter with that litter of little ones. So it's kind of sore, but it was really cool. So I'm glad it's done.
12 days ago, doctors figured that the Dangler twins would be big enough to go home to Aspen. They were half right. Ellie, the bigger of the two, is healthy enough to join her parents.
She gets to go home with us today.
But Katie is still too small to leave.
I wish both of them were coming home, but another week or two, hopefully. So it'll work out.
Babies need to weigh at least 4 pounds to come out of the isolette. Ellie's weight, 4.4.
You look pretty cute.
Katie's weight, 3.6.
Ellie just weighs more, and so she's able to hold her body temperature. And she is eating all her foods by bottle and just consistently gaining weight. And Katie doesn't weigh enough to come out of the isolette yet. As soon as she weighs enough, then she starts doing all the stuff that Ellie's been able to do. Nighty night.
Kotomi Yoshida has been on Pitocin for the past 7 hours. She's finally at the stage where doctors can break her water and get her labor going.
The water's clear. All right. The contractions will probably get a little stronger. When we break the water, it helps the Pitocin work better. I still think you're going to go during the night sometime. We'll see you later. Okay.
It's stressful for this first-time mother as her body prepares for the job ahead. Kotomi's long pregnancy has evolved into a long labor.
It's 11:30 and I hope she has a baby by 2:30. Keep going up on the Pitocin every 20 minutes. Just my fingers. A little bit of pressure.
9 hours after induction, Kotomi's body is finally ready to deliver.
You are 6 centimeters. 90% and -1. You want to twist that way again?
But the last step of her labor will prove to be the longest yet.
I'm excited.
I'm ready. I'm exhausted. Come on, baby.
After 41 weeks of pregnancy, 2 days of contractions,
Start pushing, all right?
and 9 hours of labor,
You're ready. Give us all you got, okay?
1, 2.
Kotomi Yoshida is finally ready to deliver.
You're awesome. That's a girl. Keep going, keep going.
9, 10.
Big deep breath in. Last one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, keep going, keep going, keep going, keep going. You're awesome.
But even the delivery is long, 40 minutes after she starts pushing.
Stop pushing.
Stop pushing.
Stop. Don't push, okay?
Doctors discover that the baby has the umbilical cord wrapped around her neck.
Give me a push now.
Well, there was back behind,
Baby goes.
They also notice she's covered in meconium. Chances are she inhaled some.
She does have some act. Looking good, baby. 10-10.
What a messy kid. Greedy for mom. So good, huh?
In order to help clear her lungs of the meconium, nurses tap on her back.
She looks totally Asian.
No.
That's a girl. Cut that out. That's yucky stuff. You don't want it anyway.
It took a swallow of some of the amniotic fluid. Sometimes they don't breathe as well when they do that, so we had to just pat it on the back a little bit, break up some of the secretions, and suck it out. That's pretty common.
Kotomi names her baby Kayuki. It means snowflower.
Mom's healthy, baby's healthy, everybody's crying. Yeah, that's the neat stuff to see.
It's the end of a long journey, and both mother and baby are utterly wiped out.
Lindsay Nicole.
Christine Holmwood has been waiting for this day
It's rough being 3 days old, isn't it?
for a long time.
I know she's only 3 days old, but I can't remember what it was like without her already, you know? I just feel like she's always been here and she's meant to be for sure. She's not going anywhere, huh? She's the one that's supposed to be here. We're going home. We're going home.
After the devastating loss of her twins less than 2 years ago, Christine is finally going to take home a healthy baby.
I'm ready. It's been a 2-year struggle, and this is kind of the end result. This has been a little miracle, but it finally happened.
We thought our journey was at the end, and now I look at her and I just think, it's just beginning. I think she's beautiful. I want to take her home right now. I haven't gotten to see her too much, so.
Although she still needs to keep up her body temperature and she's taking her meals through a tube, today Berlin Mercer moves to the graduate nursery.
Yeah, I think that we're making progress.
After 6 weeks of bed rest, coupled with the fear of having a disabled child, Anne knows the worst is finally behind her.
They were worried about a couple of syndromes they thought might be a possibility, and it doesn't look like that's the case, so she's just small. She's really small, 3 pounds, 10 ounces. But she's perfect. Like, she's proportionate and everything's symmetrical. She's got all her fingers and toes, and those lips, I can't get over those lips. She is perfect, and she couldn't be more perfect, so she's incredible. Yep, we're pretty lucky. We got a good one.
Don't do that.
Kayuki Yoshida is going home today.
I was thinking it'll be really hard because I never had any babies around me, but it's really, really fun. It's fantastic. It just makes me want to cry sometimes just holding her.
And her parents have adapted nicely to their new roles.
I knew my life was going to change radically, so I was just scared before, but it just doesn't seem as crazy and far-fetched as it did like 9 months ago whenever we got started on this.
I'm really happy about being a mom. It's really exciting. At first, I was just really glad she has everything she needs to be a human being, and she's really healthy. But now I'm really glad because she's the cutest baby I've ever seen. It is a big day today, but I don't know, it's gonna be bigger and bigger every day. But I'm ready.
These women entered the hospital, heads filled with questions, apprehension, and fear. They leave with hearts full of joy and their arms full of special deliveries.